All right. My name is Erik Martin. I'm an emergency physician. I live in Joplin, Missouri, and I'm here talking to Jim Furgerson, who is one of our local. He's positive for the coronavirus. He has the coronavirus. So, Jim, just tell us a little bit about yourself, and then I'm going to kind of talk clinically about how you got it and how you're doing.
My name is Jim Furgerson. I'm the fire chief with the city of Joplin. I also do some PRN paramedic with Newton County Ambulance.
All right. And right now it's Saturday afternoon. When were you, you had a known exposure or to a patient that you had that there was a suspicion that he had the illness, correct?
Yes, we were dispatched to a call early Monday morning for a possible, for shortness of breath, fever, things like that, possible exposure to a previously known positive case. Yes.
Okay. So you were dispatched to this patient's house, and you had some forewarning that he might have it. He told the dispatcher when he called, "Hey, I've been exposed to coronavirus." So you were expecting that, correct?
We were, and that information enabled us to at least take the proper precautions in 95 mask, gloves. So.
Okay. So tell us, when you got to the house, did you go into his house? Did you go into his room? What went on there?
We did. I mean, we made patient contact. I stayed about 8 to 10 feet away from the patient the whole time until we actually had to move him for transport. I had his wife place a surgical mask on the patient.
Okay.
At one time when he stood up, he got sick, vomited in the surgical mask. His wife grabbed a towel, kind of cleaned him up, and then I gave her another mask to place on the patient. And then
so you were in his house at that time when he vomited. But you weren't right next to him when that happened. You said his wife kind of helped clean him up.
That's correct.
And you gave her another mask, and she put it on him.
That's correct. Yes.
Okay. And was he? Did he look sick when you went there? He was short of breath. He needed to come by ambulance. You kind of had to help him out of the house. Is that right?
That's correct. Yeah, he was weak. Definitely could tell he had a fever even when I grabbed him to kind of help him to the cot.
Mm-hmm.
A little bit diaphoretic, not horrible.
Sure.
But you could tell he wasn't feeling well.
What kind of PPE were you wearing at that time?
Gloves and N95 mask throughout the whole.
Okay, you were wearing gloves, N95 mask. Did you have a full gown on, or just the mask and gloves?
Just the mask and gloves.
Okay. And so you took him outside, put him in the back of the ambulance, and you were in the back of the rig with him on the way to the hospital. Is that right?
That is correct.
And did you do any procedures on him? How did you treat him once he was in the ambulance?
We monitored his pulse ox, blood pressure. I went ahead and threw him on a non-rebreather just to also help kind of protect us. If he did cough, he coughed into that instead of anywhere. And then I started an INT on him. Okay,
so you started an IV. You put him on a non-rebreather. You didn't give him a breathing treatment, though, a nebulizer treatment, right?
No. At that time, we were getting guidance not to do treatments that produce aerosols, things like that. So we kind of, stayed away from that.
Okay. And when he was in the back of the ambulance, was he coughing a lot? Was he sneezing or not?
He was not, actually. And that was the surprising thing is I don't remember him coughing at all. I mean, he may have. That's been a few days ago.
Yeah.
But I do not recall him coughing at all.
Okay. So you took him to the hospital, you took him to the ER, and you kind of gave your report. And what was the total amount of time you were with him, where you were in close contact, you think?
Oh, I sat behind him during transport, so I never, other than when I started the IV, after I got the IV started, I sat behind him.
Okay.
And called the hospital. Total transport time, man, I don't know. Maybe in close quarters with him when I was back in the ambulance with him was probably 8 to 10 minutes, maybe a little more.
8 to 10 minutes.
Yeah.
Did you use your stethoscope to listen to him, or what did you do there?
I did not. Like I said, when I put him on his O2 sats, it was around 99 to 100. You could definitely hear the raspiness without using stethoscope. So I didn't think that was necessary. But no, like I said, I wanted to be behind him as much as I could, just if it did. So
it sounds like you observed pretty much all the precautions we would do. You kept as much space between you and him as you could. You were wearing your N95 the whole time. You were wearing gloves. Can you think of any other way that you could have been exposed, that you could have caught it from him?
Well, I talked to the operations manager in Newton County today, and that was one of the things that I kind of visited with him on as I thought back on, where could that breakdown have occurred. We use iPads to do our reports. I had to have him sign the iPad, and then once he signed it, I took it back from him. That could have been a possible transmission. Did I get it on when I was inside the house? Because we were in the bedroom for a little bit to try to get him out. So, those are the only two breakdowns that I really see that could have occurred, are those two things.
So you, with just about every patient that comes, you have a little iPad where they sign their name on it. You handed that to him, and he handed it back to you, although you were wearing gloves. But and the only other time you really were close contact was just helping him out of his house, getting him into the ambulance, right?
That's correct.
Okay, so that was early Monday morning, 2 or 3 o'clock in the morning, something like that. And when did you start feeling sick?
Well, I noticed some chills and maybe a little bit of body aches on Tuesday late night, like overnight, but I never ran a fever.
Okay.
Got up normal. Actually took my temperature in the morning just to make sure that I was doing okay, because monitoring my temperature anyways, once I found out that this gentleman had a confirmed positive test, I started monitoring my temperature a couple times a day. So I woke up that morning, my temperature was normal, went to work, took it a couple more times. It was still normal, 98, 99, nothing big. Sometime in the afternoon, probably about 1:30, 2 o'clock on Wednesday, I was in an office on a conference call, and all of a sudden I just got, very tired. I just didn't feel well. Took my temperature. It was 101.6, I believe.
Okay.
So then I immediately left the office and sought a test, just to find out.
So that sounds like maybe only 36 hours, 2 days after the exposure, you were running a fever.
It was a very rapid onset. It like you said, it was, you always hear the 14-day a week. This was a very rapid onset for me. So.
Yeah, I think you're kind of at the lower end of the range. I've read anywhere from up 2 to up to 14, with the average being maybe 5. So you were kind of at the low, and that's the only known exposure you've known of, unless there was some other exposure before that you're not aware of.
That is correct. Yeah, that's the only known exposure. But as I visit with, unfortunately, with the way this virus is, it could have occurred, a week before, who knows? But yeah, that's the only known exposure that I've had.
Okay. So that was Wednesday. You had a fever, cough, you felt kind of body aches, that sort of thing?
Yeah, really just mimic the flu.
Okay.
Even yesterday, it just felt like I had the flu. I had a little bit of chest pressure, but my lungs have been clear the whole time. My wife's a nurse. She listens to me every once in a while just to make sure. But the whole time, it just really felt like I had the flu for me.
When did you find out that patient was positive? Did you know that soon? Did you know that before you got sick? Were you notified, something like that?
I did know he was positive, but I wasn't notified. The only reason I found out that he was positive because I read it on Facebook. It was kind kind of irritating, to be right honest with you.
Yeah,
But that's how I found he was positive. And he actually, it was actually quick turnaround on him as well, because it was less than 24 hours, I believe, for them to get the results, and that's how I found out.
So how did you go about getting tested yourself once I mean, you're in that, right now the CDC's got these different priorities, and you being a healthcare worker with a exposure to a known positive, that's one of the top priorities. How did you get tested?
So as soon as I realized that I was sick and become symptomatic, I contacted my part-time employer, and they were able to get me into an urgent care facility to get tested, and that's how the testing went about for
Okay.
me.
Did you call that local? There's a local hotline here in Joplin. Did you try to go that route?
We did, and unfortunately with that, this was on a Wednesday that I called. They weren't going to be able to test me until Tuesday afternoon, so we went that route.
So you called them on Wednesday, and that would have been 6 days later that you would have had an appointment. That's that testing center here locally.
That's correct. Yes, it was going to be that long.
Okay. So you contacted your someone through your organization, and you were able to come to urgent care to get tested. That's how you got tested, right?
Yes.
Okay.
Yes.
And so that was on Wednesday. That was on Wednesday when you started feeling sick, and you got tested later that day. Is that right?
I did. Yes.
Okay. And you've been in home self-isolation since then?
I have, ever since Wednesday afternoon. I've been confined in my bedroom.
All right. You doing
Not fun.
okay?
I am actually. I've been fever free all day today. Body aches have subsided.
Mm-hmm.
I still have, chest tightness. You could tell that just something's not right. Like a bronchitis-y type thing.
Okay.
No fever. The last time I had a fever was around 2:00 this morning, and that's the last time I took any Tylenol as well.
So you might already be getting over it. You don't have a fever now, and you got just a little bit of tightness in your. What about the fatigue? Do you still have that, or is that better too?
I have no. I mean, probably Thursday afternoon and some of Friday was probably the worst for the fatigue, but today I felt fine. Other than having to be sitting in here, I'd rather be out doing something, but that's the only, so no, I felt fine today.
Okay, good. And anybody in your family had any symptoms to speak of yet?
So far, no, thankfully, and of course, they're monitoring themselves as well, and but no, everything's been good. So
okay, very good. Well, thanks for doing this. I think there's a lot of even I was guilty of, I've been paying attention to it when it was in China, and, you heard about it in the news in New York, in Seattle, and I still didn't anticipate it being here, and it's here.
right. I'll be honest with you. Last Monday, the 16th, I was in the same way. I was like, this is all just a hoax. It's all just a bunch of they're politicizing it, and so I wasn't taking it as serious that day. But as that week wore on, as I started, I became taking it, more and more serious and things like that.
So what would you say as a coronavirus patient, and you're doing fine, you probably will do fine. You're in good health. How old are you?
44.
44. So you're not in that high risk category, older patients with comorbidities. You'll probably be fine. But the patient you saw that you transported, it sounds like he was pretty sick.
He was, yes. If you're, if I give any advice to the public, obviously, is if you don't have to be out, don't be out. That's the thing about this virus is, as you know, it can be anywhere. It can be on anything. As an EMS provider, as a first responder, I mean, it's like I told my guys and gals today, wear that stuff. Even if it's just the lowest exposure that you think, it may not be legit, but wear your protective equipment, all of it. And we got to think outside the box sometimes. As I would have never expected to have it on my boots. I told we need to start deconning our boots and things like that. Just you had the PPE, wear it. So.
And maybe the practical advice for the EMS people, first responders, wear your PPE, pay attention to like the iPad or the shoes. You really don't know what it was, but something between that patient and you, even with the equipment on, something happened for you to get it.
Yeah, unfortunately, there was some breakdown somewhere, and boy, I wish I could really pinpoint it. But those are the only two that I can think of right offhand, because there was no direct fluid contact with the patient. There was no, the only contact we had with the patient was we grabbed him under the arm, and he kind of walked with us. That was our only contact with the patient.
Yeah.
But other than that, there was zero contact with the patient. So.
And you were wearing gloves and a N95 mask when that happened.
Yes.
All right. Well, thanks for doing this, Jim. I'm going to reach out to some of my colleagues, physicians, nurses, and you can share it with your EMS people too. We'll put it on a YouTube link so people can get to it. Does this, do you feel scared about this? What do you feel?
Not really. The night that the event occurred, obviously there's a little bit of, I don't want to say fear, but maybe some trepidation.
Sure.
But it is what it is. I've done this going on 25 years. And fortunately, this is the only occurrence that I've had where I've, actually got sick from something like this. So I'm not really scared. I feel great right now. I feel, like I said, I feel very good today, and we're only 2 days into this. So like you said, I think I'm maybe be a quick recovery, I hope. But no, I really wasn't scared throughout the whole event. So.
Well, hopefully you recover well, and you'll be back on the front lines soon, because that's what we do, right? I'm not really scared either for myself, and I've had a couple of potential cases in the ER where we've had to get all gowned up and gloved up, and it is that trepidation you talked about, that little bit of anxiety that people have, just wondering, not knowing. But still, we do what we got to do, right? That's what we signed up for.
That's why we're called to do what we do. So.
All right, thanks, Jim. I'll check back with you later. Maybe maybe we can do a follow up and see how your symptoms are later on.
Sounds great.